Hi Rachel. We're here today to chat about public and patient involvement and how it affects your work in research. I'll just introduce myself and tell you a little bit about me. So my name is Liz Molloy, and first and foremost I'm a parent of a patient with rare disease, and as a result of that I have gotten very involved in patient advocacy. I am co-founder and co-president of an advocacy group, GACI Global, and we support patients worldwide affected by the rare diseases that affects my family. I'm also very interested in being involved in research, so I have worked on PPI, Public and Patient Involvement, with the Rare Disease Clinical Trial Network and with the HRB, and it's been fascinating. So I'd like to talk to you today to hear more about that and how it affects your work. So maybe you could tell us a bit about you.
So I'm Rachel Crowley. I'm a consultant endocrinologist at St Vincent's University Hospital and a clinical professor at UCD. And I set up the Rare Disease Clinical Trial Network with another UCD researcher, Professor Cormac McCarthy, to try and bring more clinical trials to Ireland. And part of that is about training more doctors and researchers in rare disease research and methodology and techniques that might specifically apply to rare disease, but also to involve more patient input and more public input into research questions and methodology into rare disease. And I got involved in that because of working in a rare disease field myself, and obviously I've worked with you and you've reviewed grants for us and given us input on what directions we should be taking in the Rare Disease Clinical Trial Network. So I'm really delighted to have the opportunity to sit down today and chat through our experience of patient and public involvement in rare disease research.
Great, so I have some questions here and I've written some of them down just in case my nerves make me forget them, so if you see me looking at the cards. So can you share a bit about your background and what initially drew you to the job?
So I suppose working in endocrinology, we look after lots of patients with rare diseases. Endocrinology is a specialty looking at hormones, and so people often think about things like maybe fertility or menopause management or thyroid, but it's a really broad specialty. And so even back when I was a medical student, I was looking after lots of patients with rare diseases and got interested in maybe reading around more, finding out what were the questions that we didn't know answers to, getting some sense of how that had an effect on people's lives and on their families' lives. And when I went to do research as a trainee endocrinologist, so after I became a doctor but before I was a consultant, I did my MD in a rare disease, craniopharyngioma. And that, I think, gave me skills to talk to patients and their families with rare disease, no matter what the actual diagnosis was. And I started thinking, the further I got on, more broadly about rare disease and what were the questions to answer. So myself and Cormac McCarthy, who also works at UCD, set up a rare disease clinical trial network to try and bring more clinical trials to Ireland for patients living with rare disease here. And that was funded by the Health Research Board. And we're also looking at training doctors and scientists in rare disease, and again, meeting with families and patients and saying, you don't just have to participate in research, you don't just have to give your information or your blood samples or your scan results into a trial. You can actually be a researcher yourself. You can help us to design a research question. You can tell us what's important to you. You can review grants and give your opinion about who we should give money to if we're designing research projects. And so what I work in, as the years go by, has gotten more and more broad and applies to more and more families, and hopefully that means that my work can have a broader benefit across lots of people.
Great, that's marvellous, because I know from the patient and family side of things, that's so important to have your voice listened to and to be able to have input. So what was your aha moment regarding public patient involvement?
Okay, I don't think I had one moment where I realised that patient and public involvement was important. I don't think there was any eureka. I think it was a slow creep. I didn't have an idea of what patient and public involvement was when I was a trainee, either as a student or as a non-consultant hospital doctor. But then I started to become involved in projects where, for example, the Alström Syndrome UK funded research and the patients said what they wanted to have looked at by the doctors. Or I started, when I was working in projects, to listen to what patients said, and they said, oh, we don't know the answer to this. Why does this happen in this disease? And I go away and look something up and go, actually, nobody knows the answer to that. That's still an unanswered question. Is it important to you? Yes. And when UCD got involved in the Public and Patient Involvement Ignite project, which is now a national group, I realised that there's a formal way of looking at this, that there is actually a framework for researchers and patients and carers to work together to design research questions, and that a shape can be put on it. And so I think it was a long time coming and a slow kind of a burn for me, rather than one moment where I went to a conference or was working on a project and went, this is really important.
Right. And if you were giving advice now to somebody who was starting out in research or an institution and, you know, they wanted to integrate public and patient involvement into their work, what advice would you give them of how to get started?
Okay, so what advice would I give to a researcher starting? I think there's definitely two pieces to that. So one is that you're working with patients and families that may not have experience of being researchers in the beginning, and they may not understand the difference between a research question and their own clinical care, or they may not know what they're entitled to in a research relationship or what being a collaborator looks at. So I think if you're a researcher, you should learn some basic skills first yourself about that. You should learn where the boundaries are. You should learn how to look after a patient collaborator as a researcher, because it's slightly different to working with a scientist or another doctor. And once you have done that, and there's training available for that through loads of different bodies, then I think you should look to where your patient and family collaborators would be. And you'll probably have lots of them in your own clinics, or if you're a scientist with a clinical collaborator that you work with. And there are lots of patient societies that you can reach out to. And there are umbrella groups like Health Research Charities Ireland, who are a partner of ours in the trial network. And then you should have it very clear in your mind what that relationship is going to be, what the ask is, how much time you think they're going to need to put in, whether there are any financial supports for them to travel to meetings or compensation for their time, so that when they're signing up to work with you, that they know what they're committing to. So I suppose, as I've said, two things that you should think about: building your own skills in working in that relationship, and also who you might work with, and what that group might look like and where you might find them.
Right. And from the opposite side of that, I suppose it's very nerve-wracking for the patients and the public in general to kind of be asked to participate. And, you know, that training that's available for the researchers is also available then for the patients and families. And I found that to be really, really good. And it really shows people that, you know, you can have an input and a voice. So that has been great. So is there any project that would stand out to you where patient and public involvement really made a difference in how the project was shaped or the outcome?
Yes, I think, well, we've all recently lived through the COVID pandemic, which had a huge impact on people's lives. And before that, researchers were very interested in how would we get information quickly in a pandemic situation where people were getting sick very quickly, and we would need to get information fast on a new disease condition. And Alistair Nicholl and his group in the Critical Care Network, which is also a UCD network, did a lot of work before the pandemic in what they thought might be preparation for an influenza pandemic, because before coronavirus came, that's what we thought was going to be the jeopardy. And that information from working with patients and the public, saying, this is the type of research we think is important, this is how we think it's appropriate to ask for people to consent to be in research when maybe they're in intensive care and they're under pressure and their families are under stress. That information was pure gold when they were trying to set up data collection and trials and biobanking samples from people with COVID when the pandemic broke. And I think the foresight that the researchers and the time that patients and the public gave to thinking about these questions really helped society as a whole when the pandemic hit. And I hope they realise that. I hope that they know that their contribution was really, really important to the world when this catastrophe hit, and that we were able to get research up and running really fast and in a way that was appropriate and ethical and safe for patients once the pandemic came through.
Right. No, that's brilliant. And you make it sound so easy, but if it was easy, obviously everybody would be doing it. So, like, what are the challenges that are preventing people from doing this, or preventing them from doing it well, and how can we maybe overcome those, or even start to overcome those?
So I agree with you, it's not easy.
No.
It is not easy. It's very challenging. But if it were easy, probably it wouldn't be so worth doing, because it would have been done already. If we already knew what people thought about things, why would we have to go out and seek it? Getting different perspectives is always hard. Being respectful of people who are coming from a different perspective is challenging. So what are the challenges? For patients, I think some people, particularly in rare disease, have a history of having had bad experiences with healthcare systems. And so when somebody who genuinely wants to find their opinion out and to work with them then approaches them, there may be a time that you need to put in to build up some trust. I think that's really important. I think spending time getting the skills together to work with patients and public researchers would help you with that. You would have a little better idea how to build trust. Saying, this is the commitment we're looking for from you, and sticking to that, and honouring that commitment and making people feel valued and that their voice is listened to is really important. And we're living in a time where people are really vulnerable to social media and alternate sources of information. And it is really difficult for somebody who doesn't have any scientific training to unpick what's disinformation and what a bad actor out there might be trying to do, and to understand that maybe this researcher is not looking to manipulate them into it in any way, but is genuinely interested in their perspective. So I think people need to be supported in that, and you need to take time. For the researchers, maybe for science-based researchers rather than the clinical ones, they might not have a relationship with a patient group or an individual patient who can help them with this, and they may feel very distant from that. And something we hear a lot from people who are doing perhaps bench or lab-based science is that they don't see how patient and public involvement might tie into their science. They don't think that patients could maybe understand a really complicated scientific concept. But we know, we've had a conference where we had guest speakers from around the world. The really good guest speaker who knows their topic well can engage with groups of patients and explain to them a difficult concept simply. And because they understand their topic really well, they are able to drill it down into basics. And so I think that giving people the skills to communicate and to engage and to understand builds that relationship, that trust. I mean, we're pushing against an open door with the funders, because now internationally funders are looking to fund research where patients have said, this is important to us. Or that the public has said, we're taxpayers and we're funding this research and we want you to spend it on something we think is important to us as a community. So I think that's not as hard as it used to be to try and get it through. But no, it takes a lot of time and it isn't easy.
And I'm sure it's also a challenge to try and, find time that, these people are available, because patients and carers are typically very busy too. So flexibility is probably hugely important in scheduling meetings and things like that.
Yeah, everybody in research on all sides of the table is time poor. Yes, I agree that patients and carers already have massive time commitments, particularly ones who are trying to tie down either a full-time job with attending a lot of medical appointments or trial work, or with caring responsibilities. I think one of the things that we've learned from PPI is breaking down that commitment into bite-sized chunks and saying to people, actually, you don't need to be a researcher putting in 5 hours a week. You could drop in and out when your medical condition or your caring responsibilities allow, or you could communicate with us by email and drop us a message saying, I've had a look at this document and this is what I think about it, on your own time. I think it's really important to say to people that there are different ways of contributing and they're all really valuable.
Definitely, yeah. So what has been the most surprising thing you've learned by embedding PPI, public and patient involvement, into your work?
I suppose the surprising thing, it shouldn't be surprising, is that you never know what anybody is thinking. We make a lot of assumptions that a talk is going a certain way, We do that in our clinics and in the emergency department all the time, that we think we're communicating. And what I've really learned is that you have to stop and say, what are you thinking right now? What did you think about what I just said? Have I upset you? Are you interested in this? Did we lose you by what we said? And I'm sometimes really surprised by what people come back, and sometimes really surprised by what they project to me, and they say, you were thinking this, and I was going, I really wasn't. I really didn't think that at all. And so getting the lines of communication open sometimes throws up things that you never saw coming. That's probably the surprising thing. Shouldn't be surprising, because that's personal interaction, nothing to do with medicine or science, but sometimes you can be really surprised by what other people are thinking.
I would say you get some fabulous answers to that question.
Yes, some that I never saw coming.
Maybe even if you were asking children that question, you definitely get different answers than you expect.
But isn't that so rewarding?
Absolutely.
It's interesting that you raise the point of children, because in rare disease so many conditions are hereditary that a lot of research is actually done with children. And sometimes we make the mistake of only talking to their parents or their guardians or their carers and asking them for perspective. But what kids can bring to the table in rare disease is fascinating. And what they tell us, like, they're often not looking for a cure, but they want to go to school, or they want to play a sport, or they want to see more of their friends. And something that we could do that would help them do that would be much more important to them than going on a drip that made their disease go away. And they can be funny, they can be angry, and they can show a lot of insight. You should never make any assumptions when you're chatting to a kid about their rare disease condition.
I'd say it can be fun. But, so my last question is, what drives your personal commitment to make PPI more prevalent in your work?
So I think as a doctor, I like to fix things. That is a personality thing. Sometimes I do not know the answer. Sometimes there is not a cure for a condition, but there is a challenge every time you go into a clinical conversation. And what can I do to make this person feel better? And sometimes it's not obvious and you have to ask. And that could be the individual clinical discussion that you're having as a doctor, or you could be thinking about this group of people as a whole and doing research and saying, what could I test that might answer that question for them? And when I say fix, I don't want to be dismissive of people for whom their disease is part of their identity and they're living with it a very long time. I mean, how can we make things better? How can you reach your full potential? That's what I'm here to do. And the longer I work, the more I think that question's really broad. And the more I think that I have to put some work into figuring it out. And I can't do that. I can't do that without the patient or their family or the public who might fund my research or support my clinics. I can't do that without their perspective.
So thank you for your insights today on public and patient involvement into research. It's been very enlightening.
And thanks very much for your time and interest in it, Liz.